There is a difference between colon cancer and rectal cancer. The treatment of rectal cancer is much more complex than colon cancer. In order to cure rectal cancer, most patients need surgery. Depending on the location and the stage of the cancer is whether they also need chemotherapy and radiation treatment before surgery and potentially chemotherapy after surgery. Once you have a diagnosis of rectal cancer, we need to appropriately stage your cancer in order to know what treatment you need. So that involves an MRI of the pelvis, a CT scan of the chest, abdomen, and pelvis, the full colonoscopy with your biopsy, which most people have by the time that they've come to us, as well as an exam in the office called a proctoscopy. One of the benefits to getting your treatment at Nebraska Medicine is that we have a multidisciplinary approach to the treatment of rectal cancer. So we have specialists not only in surgery, but also in pathology, radiology, medical oncology, medical genetics, and we meet together as a team on a weekly basis to discuss all of our rectal cancer patients. This enables us to create an individualized treatment plan for each patient before treatment is initiated, and also allows us to provide a more specialized approach to the treatment of rectal cancer. As a board-certified colorectal surgeon, I've had advanced training in the treatment of rectal cancer. I specialize in both minimally invasive and open surgery for rectal cancer. My preference is to do laparoscopic or robotic approaches, if at all possible, because it allows for patients to have a much quicker recovery with smaller incisions. Multiple studies have shown that patients who have surgery from a colon and rectal specialty surgeon have a better chance of surviving their rectal cancer, as well as a much lower chance of needing to have a permanent colostomy. Nobody likes to talk about their bowel movements, nobody likes to talk about their bottom. People tend to be embarrassed about it, but I feel like part of my job is to make people feel comfortable about talking about the things that are wrong. And so it's important, if you're having symptoms, to discuss them so that you can get the appropriate treatment.